Sunday is the start of National Infertility Awareness Week.
And the week will coincide with the rise in fertility benefits available to workers across the country. U.S. employees are increasingly gaining access to services including egg freezing, in vitro fertilization, and surrogacy. As of 2020, more than 40% of U.S. employers with 20,000 staff members or more offered coverage for IVF treatments. Almost 20% offered egg freezing.
According to the CDC, 1 in 5 heterosexual women in the U.S. between the ages of 15 and 49 with no prior births are unable to get pregnant after 1 year of trying. And within this group, roughly 1 in 4 women have difficulty getting pregnant or carrying a pregnancy to term. So joining us now to talk about this is Peter Anevski. He is the CEO of Progyny, a leading fertility benefits management company in the U.S. Pete, thank you so much for joining us. I'm so excited to talk to you because I do think the issue of fertility is so important, not just to working women around the country, but working men and women around the country, right? This is about families and starting families. So can you explain the origins of your company and how exactly it works to provide fertility benefits to U.S. employees?
Sure. Thank you so much for having me. Our benefit was established in 2015, really because of the issues that you're highlighting. Typical health plans either didn't offer coverage, or when they offered coverage, it was inadequate. And so what we were created to address those issues and create a customizable benefit for employees when employers offer it. Very important issue.
And Pete, as we know, fertility treatments, they are expensive. So how do benefit services like what your company is offering here make them more affordable?
Well, really, if you think the issue that makes them expensive is the fact that the lack of coverage, right? Fertility treatments are generally 10 to 14 days long. They require 2 surgical procedures. You engage with your doctor. They require specialty drugs, right? And really comparable to any other of healthcare, the expense isn't different. What makes it expensive is lack of coverage, and so therefore, to the extent that you need it from the perspective of building your family and don't have coverage, it becomes expensive to the individual, and that's what's really important.
Now, we know it's a tight labor market out there and companies are competing for talent, Pete. Over the last year, Progyny has doubled its client base. So around how many U.S. employers does the company currently serve? And why do you think an increasing number of them are seeking to offer benefits like fertility treatments to their employees?
I think you hit it on the head. The number of companies we is 265 clients representing 4 million covered lives. That's grown from 5 clients and 110,000 covered lives in 2016. The reason for that growth is that 1 in 8 couples suffer from the challenge of having a baby naturally, and so suffer from issues, right? Employers are competing in a tight labor market, and as a result, they need to have a comprehensive benefit offering, and fertility is becoming important component of that benefit offering, and employers really are looking to address other issues like diversity and inclusion issues, and our benefit covers that. We address an all-inclusive benefit that addresses the LGBTQ plus population. All of those components are important, and it's why they make Progyny the brand of choice when offering fertility to their employees.
And Pete, I want to go on the flip side of this because some critics, they're arguing that introducing fertility benefits in the workplace could maybe leave recipients feeling unfairly indebted to their employers or even discriminate against employees who are not interested in having a child. So how would you respond to that?
Well, I would change the word from indebted to grateful. Employees become grateful for the benefit. It shows you your company is sensitive to these issues. It shows you your company is sensitive to the fact that although it's offering you health coverage, there is a gap and there's a message around infertility, and so it should be perspective that makes those employees grateful. And as it relates to the offering fertility as being discriminatory, it would be like saying the companies that offer coverage for diabetes discriminatory against people who don't have diabetes. The reality is that the employer is offering you many benefits, and you choose to use the ones that you find necessary to help your life out, but it's not discriminatory at all.
All right, Pete Anevski, thank you very much for joining us.
Thank you so much for having me.